On October 15th to 17th, 2012, 46 invited international delegates from 14 countries participated in a symposium that focused on rural and remote communities and places around the world. The Center on Aging, University of Manitoba, and Manitoba Seniors and Healthy Aging Secretariat co-sponsored the event held in Winnipeg, Manitoba, Canada. One of the objectives of the symposium included sharing promising practices and knowledge from around the world on age-friendly rural and remote communities and places. 6 delegates were asked their thoughts on age-friendliness in rural and remote communities. What follows are the perspectives from delegates from Bolivia, Canada, Cameroon, and Trinidad and Tobago.
Why is it important that we discuss rural and remote areas specifically?
Rural and remote tend to be more sublime, quiet. Some people look at it as isolated and secluded, but really it is not. So it is an opportune time for the rural areas, especially since we had a whole exodus of our residents from Trinidad and the Caribbean going out to Canada, America, and England during the 50s and 60s. And they are now retiring, and they would like to come back and give.
So, I mean, I'd say to you, why isn't it important then? You know, it is important, and why would it not be important? It's really essential when you're talking about age-friendly, you know, whether it's at a very local level or a global level. So it's part of that community, so it's got to be part of that whole discussion. I think it's important to talk about rural and remote because of the differences that rural and remote might have, the challenges that are different in those environments, and also maybe the way that rural and remote approach and deal with some of those challenges.
We have a lot of challenges in rural areas. So, as you know, there's lots of issues around services, transportation, even housing, because we tend to have lack of stepping changes for housing for older people. So if you can get it right in the rural area, you can learn from that in order to be able to transfer into more urban settings.
Obviously, you look at the demography of the remote or rural areas, majority of the people there are the elderly people, and they need some basic services like health. There are several communities that are already age-friendly in Cameroon, for instance, and these communities are the rural and remote areas. But if we go to the smaller communities and to people who really hold strong to some values, traditional values, hold strong to the family unit, hold strong to the cultural ethics, and you realize that they are already age-friendly and continuously working because the tradition never dies, culture never dies. The rural and remote areas also, it is easier to get people together to understand the concept of age-friendly or age-friendly environment.
Et pourquoi est-il important de discuter les régions rurales en particulier?
Ceci dit, il va y avoir des particularités, il va y avoir des problèmes qui sont spécifiques. Dans les aires rurales, on a souvent le problème des distances, on a souvent le problème des services, des soins qui ne sont pas aussi développés, aussi disponibles qu'en ville. Donc, c'est important d'aller voir quels sont les problèmes spécifiques que les aînés ont dans leur endroit, dans l'endroit où ils vivent.
C'est que, d'après l'expérience qu'on a ici, nous au Manitoba, c'est peut-être dans les régions rurales où on a eu plus de succès, parce que les communautés rurales sont naturellement peut-être plus inclusives, parce qu'il y a des éléments déjà de rassemblement et de lien. Lorsqu'ils s'assoient autour de comment est-ce qu'on devient plus amis des aînés, essentiellement ça peut devenir un autre mécanisme encore de développement communautaire. Et à cause que c'est plus petit, ils peuvent connaître parfois des succès plus évidents